It is Friday evening. It's my favorite day, and I wanted to share something with you guys. So what I wanted to talk about in this moment, and I had to do it like right now because it literally is happening right now. So we had a client that called this morning who's going through infertility treatment, and she called this morning at like 11 o'clock, and she was like, I was just wondering if I can get someone to come out and help me with my injections. I'm feeling a little bit overwhelmed. I was doing fine because she said her specialty pharmacy called her and, they unboxed the medications with her. And she says, I was doing fine and I felt like I can do it until they said that there was one medication that I would have to mix before I could administer it to myself. And she said at that point she felt like she wasn't sure that she could do that, and so she reached out to Preferred Fertility Concierge. And of course I was like, yeah, sure, we can help you. She had dinner plans this evening, and she was like, I don't want to be so anxious and caught up in the moment that I can't go on and have this dinner date with my husband, which I thought was really good for her first day of starting medications. But here's the thing. So she scheduled a fertility injection training with us. That meant the nurse went out and trained her on all the medications that she's going to have to take for her fertility treatment. And the one medication that tends to really be tricky, or that is overwhelming for a lot of the patients, is the Menopur, because it requires reconstitution, which means mixing a liquid with a powder in order for that to be at a place where you can use it. And it's kind of time consuming. It has a lot of different moving, a lot of parts to it. And so for a lot of people, having to mix that Menopur is a little bit overwhelming. Anyway, she scheduled the fertility injection training. She wanted to do it like right at 6 o'clock. And, this is like an hour-long training. She did a good job. However, her husband was there with her. And while he was so sweet, he never once offered to help her like mix the medications or to administer the injections. And I see this so often, right? And the reason is because they're afraid of making a mistake. And they're also afraid of causing pain to their partner.